Siamese twins are identical twins that have been completely separated during the embryonic period of development and share body parts or internal organs. A fertilized ovum usually divides on the 6th day after conception. If the ovum divides very late, Siamese twins forms. Siamese twins can be separated by only surgery. Sometimes it's not difficult to do if both bodies are formed correctly, but they are fused through a skin flap. In other cases, doctors face very serious problem: lack of internal organs, for example one heart, one liver and others, lack of limbs, for example 3 legs, 2 arms, which requires prosthetics, fusion of the heads, but the brains of the twins can be separated, blood loss during the operation. The plastic surgery and skin grafting need to neutralize consequences of the separation of twins, risk of losing both or one child during operation, long-term rehabilitation after operation and other problems. But some operations were successful. For example, the separation of the sisters Virginia and Tracy. Virginia and Tracy, 2-month-old female twins conjoined by the head, were admitted to the National Institute of Neurological Disease and Blindness for possible treatment in October 1956. Clinical diagnosis was cephalopagus frontalis with firm bony union of 24 centimeters. The brains were considered as probably separate, and the dura between the two corresponding parts of the brain was thought to be either absent, the two leaves fused or separate. Their normal development would have suffered if they were left joined for a longer time. Also, an infection would lead to serious consequences for both of them. With the assumption that surgical interference should be minimal, it was decided that a separation would be attempted them and that this separation wouldn't include plastic procedures. The first stage operation was performed when the twins were 3 months old, on November 9th, in 1956. The separation was relatively uneventful. The skin was incised and retracted. After the skin incision, the rongers were used to separate the bony union. After the dura was incised, a portion of the underlying cortex was exposed. The postoperative course was benign and stable throughout. The general condition of both infants was good. The second stage of the operation was performed on December 11th, in 1956. The main aim of the separation was to separate the twins and the cover result dural, bony and skill defects. Next, the cortex was examined for a division. Approximately 4 centimeters in its depth, the frontal lobes were fused directly by means of a fasciculus of white matter 2 centimeters in diameter. This bundle contained a lacy network of anastomosing vessels, one of which, an artery, had to be served during the course of separation. In accordance with previous plan, the large wound defects were covered with reconstituted human dural and skin. The skin would provide a temporary covering. This approach was adopted in order to decrease the risk resulting from many surgical operations. Obviously, the more orthodox plan would call for plastic procedures and this additional surgery. The wounds were dressed and the patients returned to wards in good condition. The postoperative course of each twin wasn't remarkable. For the first 2 weeks, the wounds were dressed each day with bacitracin-saturated gauze. During this short period, the skin graft degenerated and the dural sheets became adherent to the surrounding dura of the infants. There was a considerable leakage of cerebrospinal fluid from the wound of each infant, and Virginia developed Friedlander's bacillus meningitis. This infection cleared within 3 days on energetic treatment with antibiotics administered systemically and locally. After a month, the dural grafts were observed to be sealing at their edges close. The examination revealed the presence of fine blood vessels at the junction and their radial growth towards the center. At the beginning of the 6th month after separation of the twins, the dura was covered with 4 separated applications of calf embryo skin. These skin grafts finally resulted in completely covering the external surface of the dura mater. At the age of 1 year, the surface of the primary wound was completely epithelialized. Nowadays, the Siamese twins are being successfully separated and both infants stay alive.